Hi there, my name is Brittany Kirby, and this is my critical race narrative. My racial identity has always been something difficult for me to understand and dissect. I grew up with a white dad and a Hispanic mom. My first vivid memory of encountering race was when I was 10 years old. My mom was driving my sisters and me, one of whom appeared white and one of whom appeared Hispanic like our mom, to a soccer tournament in LA, and we were pulled over by a police officer. The officer asked me and my white appearing sister to step to the front of the car and our mom and Hispanic sister to step to the back of the vehicle. The officer proceeded to ask me if I knew the woman driving us, what our address was, and if I knew my dad's number so he could call and verify our relationship to our mother. This was my first experience with race, which occurred during Erickson's school age development. I did not have the words to explain it, but this is when I realized I was different than my mom. This wasn't very clear for me because she was my mom and I admired her and wanted to be like her. I didn't understand why there was a difference between us, and it created a lot of confusion for me. This experience took a long time for me to navigate and disentangle myself from. I have always struggled with my own racial identity. I grew up in a suburb of Phoenix with a mixed race family that assimilated into white culture. As I grew up, I wanted to know more about my heritage, and I tried to immerse myself in the Hispanic culture. My mom shut me down because of her own shame. It wasn't until I became an adult that I was able to learn about her family and their experiences. I was given a memoir written by my great-grandfather, which allowed me to learn about his life and the adversity he faced as an immigrant working on the railroads. I currently work at an involuntary behavioral health hospital in Phoenix as a behavioral health tech on the all-male unit. I have seen countless examples of institutionalized racism at my workplace. One of the most shocking is that white men are given more opportunities to dictate their treatment than men of color. By this I mean we have had men of color and white men who have the same insight into their diagnoses, but their doctors treat them very differently. We had one white patient who was incredibly manic. He was petitioned because he had spent $6,000 on random things, literally physically lost a new truck he had just purchased, and was threatening to kill his family. This patient had significant psychiatric history in a different state. This man denied any history of medications or treatment. He told doctors that he would only take one specific medication and would refuse anything else that was offered to him. His doctors prescribed him the medication he wanted, and he ended up staying an extra 2 to 3 weeks because he needed a different regimen to stabilize. At the same time, we had a black man with no inpatient psychiatric history who was petitioned because he started banging his head on the window in the back of a police vehicle after he was arrested. The black man was forthright and said he had not been taking his medications because he hadn't been able to get to the clinic. The black man told his doctors what he had been on and what had helped him in the past. Instead of stabilizing him on the medications he had previously been stabilized on, they started him on 2 different medications. After about 3 weeks of failing this regimen his doctors had him on, they started him on the medications he had originally advocated for. The institutional racism associated with this specific story goes to show that the white patient was given what he wanted and ended up needing something different. The black man knew what he needed and was giving something other than what he had advocated for, and ended up staying longer just to end up on the medication regimen he had initially advocated for. A comparative study done by the National Institute of Health indicated that African Americans, Hispanics, and Asians reported significantly more perceived provider discrimination and poorer health compared to non-Hispanic whites. This statistic was interesting to me because what I have witnessed suggests that the perception of providers' discrimination may have some basis in fact. As a BHT, it is difficult to challenge doctors when I observe racism. However, I try to provide my patients with the language that may influence a doctor to be more engaging and willing to listen to their experiences. I also try to open lines of communication with the nurses and other behavioral health techs in order to advocate for our patients with the doctors when there is a discrepancy and when the patient may know what they need when they're not being listened to by the doctors. All of this together has shown me that institutional racism is so deeply ingrained in our society, and there's so much that we need to do to disentangle all these webs.